Hello everyone, welcome back again with one more topic. It's the trigeminal nerve. The trigeminal nerve, its three divisions and its area of distribution, you already know it. My job here today is just to summarize the whole nerve and refresh your memory. And I will not go into the details of individual branches and their area of distribution and all, and their in turn their sub branches and all. So I will just summarize the whole nerve, give what are the functional components in it, and few details about its what is that course, and even its nuclei and all. So let's start. So when you look at this picture showing the whole the trigeminal nerve with its branches and its area of distribution, it looks complicated, right? It looks complicated because its wide area of distribution. So as you know, it's the major nerve of the head and face. So it looks complicated because of its wide area of distribution and big number of branches. Okay, and even its association with what is that physical association with many of these autonomic ganglia, the ciliary ganglion, pterygopalatine ganglion, otic ganglion, submandibular ganglion. So all these autonomic nerves are physically associated with this nerve. And even the special sensation like what is that taste from the anterior two-thirds of the tongue. So because of its all as physical association with these autonomic fibers and these special sensations and the big area of distribution and the many number of branches, it looks complicated, but actually it's not. So when you look at the nerve as such, it is having only two types of innervation, or what I meant to say is only two functional components. So it's a, you can say it's a not so complicated nerve, it's an uncomplicated nerve, you can say, when you look into its functional components. So as I said, it is having only two type of innervation, that is only the sensory, that is afferent, so that is your general somatic afferent, and then one more is special visceral efferent. So I repeat, so only two functional components are with this nerve. So number one is the general sensory afferent, okay, and then special visceral efferent. So these are the only two functional components, or what is that type of innervation associated with this trigeminal nerve. Even though you find so many autonomic ganglia physically related to it, but actually speaking, they are not associated with the trigeminal nerve. So they are associated with your the seventh and the ninth cranial nerve, that is your facial and the glossopharyngeal nerve, even including your the special sensation of taste from the anterior two-thirds of the tongue. So it is related to your the seventh nerve. So because of its wide area of distribution, so these branches of the seventh and what is that? The glossopharyngeal nerve, that is the ninth nerve, they hitchhike with this branches of the trigeminal nerve. Yeah, I guess, I hope you know the meaning of hitchhiking. As I said, because of its wide distribution, they use, that is the cranial nerve 7 and 9, they use the trigeminal nerve to just to send their nerve fibers through it to reach their target organ. So just they only hitchhike with the trigeminal nerve. As such, these autonomic fibers and even this what is that special sense of taste, they are not actually associated, functionally associated with trigeminal nerve, but only they are physically related to your or associated with the trigeminal nerve. Functionally, they are with the facial and the glossopharyngeal nerve, not with the what is that trigeminal nerve. So that takes out much of the what is that complicated structure that you find in this diagram. So only two functional components, so that is general somatic afferent, and then special visceral efferent. So these are the only two functional components associated with the trigeminal nerve through its branches. So we will discuss this nerve with first with this what is that? Its anatomy, like its attachment, the area of attachment to the brainstem, its roots, its ganglia, its branches, its course, and all. We will discuss in brief, and then go for the same along with the branches. We will be discussing its what is that functional components. And a third point is, as I said, the association of physical association of these autonomic fibers, and then at the end we can go for what is that its applied aspects or the clinical aspects associated with the trigeminal nerve. Okay, so let's begin with the functional components. As I said, so it is the chief sensory nerve of the, or the major sensory nerve of the head and face, carrying all the sensory, what is that, information or the impulses from the head and face region to its nuclei is present in the brainstem. So what are those sensory, what is that receptors, what is that sensory modules that trigeminal nerve carries? So as I said, it's the general somatic afferent. So general somatic afferent means the sensory impulses like the touch, pain, temperature, what is that, vibration, pressure, and and the proprioceptive impulses are carried by this trigeminal nerve through its different branches from the area of face and head. And you know the three branches are the maxillary, the mandibular, and then the ophthalmic. So even you already studied the nerve supply of face and the scalp, where you discussed the sensory nerves associated with the what is that, face and the scalp area. So these three branches. So this is blue representing the ophthalmic division of the trigeminal nerve, and the red with the maxillary nerve, and this green with the mandibular nerve. So though different branches of the maxillary, ophthalmic, and the mandibular nerve, all these general sensory afferents, they run through this trigeminal nerve and end in the trigeminal nucleus, so which we will discuss in the coming slides. Okay, so this is about the general, what is that, somatic afferent, general somatic afferent. To be specific, exactly talking it, the sensory, these all sensory inputs, that is your pain, touch, temperature, pressure, vibration, and proprioception from the face, the anterior part of the, what is that, the scalp, then the eye, the include all parts of the eye except your the retina, the nose, nasal cavity, the mouth, the oral cavity, including the gums, teeth, the anterior two-thirds of the what is that, the tongue, the paranasal air sinuses, the temporomandibular joint. Okay, all these areas are supplied by these three branches of the trigeminal nerve. So from where does these nerves carry the sensory impulses? I repeat, from the face, the anterior part of your the scalp, the nose, the nasal cavity, the orbital structures except the retina. Okay, then mouth, then you have the gums, the teeth, anterior two-thirds of the tongue, the temporomandibular joint. So these are all the areas from where all these sensory impulses are carried by these three divisions of the, what is that, trigeminal nerve. There is maxillary, mandibular, and ophthalmic. Okay, so this is the one component I was talking about. It is the general somatic afferent. So what about the other functional component? So that I said, special visceral efferent. Special. So I mean the stressing the word special. Special visceral efferent. So because you already know the nerve of the first branchial arch is your, or the pharyngeal arch is your, the mandibular nerve. So all the muscles which develop from this first pharyngeal arch are supplied by this mandibular nerve, which is a branch of the, what is that, the trigeminal nerve. So mandibular nerve is the only branch which contains the motor fibers, whereas the rest two, the maxillary and ophthalmic, are purely sensory, whereas mandibular is mixed, having both sensory as well as motor component. So only the mandibular nerve has the motor component, having this, what is that, special visceral efferent fibers. I said special because it supplies the structures which develop from the pharyngeal arch. Which pharyngeal arch? To be specific, is the first pharyngeal arch. So what are the muscles does this mandibular nerve supply? So which come under this special visceral efferent? So you know the four muscles of mastication, that is the masseter, the temporalis, and the two pterygoids, the medial and lateral pterygoids. So these four plus 4. So totally 8 muscles. So what are the other 4 muscles? The tensor tympani, tensor veli palatini. Then you have, what is that? The anterior belly of the digastric, and one more is the mylohyoid. So 4 plus 4, 8 muscles are under this special visceral efferent, which develop from the first branchial arch. So these 8 muscles are supplied by the mandibular division of the trigeminal nerve. So it's very simple. So only this is the these are the functional components of your the trigeminal nerve. So simple, right? So general somatic afferent from the face, anterior part of your the scalp. So the sensory component is, the distribution is wide. That's why I said it is the major sensory nerve of the head and face, because it carries all the sensory inputs from the oral cavity, the nasal cavity, the eye, the orbit, including your temporomandibular joint and all. So that is the general somatic afferent component carried by all the three nerves: maxillary, mandibular, and ophthalmic. So whereas the other functional component, that is special visceral efferent, supplying 8 muscles from the only one branch, that is your the mandibular branch of the trigeminal nerve. So what are those 8 muscles which develop from the first arch? That is your 4 muscles of mastication, the temporalis, the 2 pterygoids, medial and lateral pterygoid, and your masseter. And the other 4 muscles are tensor tympani, tensor veli palatini. So one associated with the tensor tympani with the ear, tensor veli palatini with the palate, and then you have the anterior belly of the digastric, and then the mylohyoid. So these are the 8 muscles which are supplied by this mandibular nerve. So these 8 muscles, they develop from the first pharyngeal arch. So that's why this nerve, the functional component, we say it as special visceral efferent. So even though all these muscles are voluntary muscles, and even they are striated muscles, not the smooth muscles. So no special sensory impulses are carried by the trigeminal nerve. Please keep this point in mind. So no special senses like the taste, the hearing, the vision, or the balance. So none of these special, what is the senses, are carried by the trigeminal nerve. Only the somatic afferents, that is which sensory what are senses, that is pain, touch, temperature, pressure, vibration, and proprioception. I am stressing the point proprioception. It slightly differs, so which I will come we will discuss in the coming slides. Okay, so these are the two functional components, only two functional components associated with the trigeminal nerve. So no autonomic, what is that, fibers are functionally associated with the trigeminal nerve. So all those autonomic fibers, actually they belong to the 7th and 9th cranial nerve. They only hitchhike with the trigeminal nerve branches because of its wide area of distribution. They take this trigeminal nerve course, or they mix with these trigeminal nerve fibers to reach their target organ, because this trigeminal nerve is having wide area of distribution. So we'll discuss that. Okay, so this is about the functional component of the trigeminal nerve. So now let's look into, so as I said, the attachment of the trigeminal nerve to the brainstem. So where exactly is it attached to the which part of your brainstem? So it is attached to the ventrolateral aspect of the pons. So where? So ventrolateral aspect of the pons. This is, you can say, in this picture you can see this is the what is the brainstem having midbrain, pons and medulla. So this is the pons. So this is what is the fifth cranial nerve, that is the trigeminal nerve. So exactly speaking, it is at the junction of the pons and the middle cerebellar peduncle. What is that? Middle cerebellar peduncle. So at that area, so ventrolateral aspect of the pons, it is attached. You can see here the two rootlets of the trigeminal nerve, the bigger sensory root and a smaller, what is that? The motor root of the trigeminal nerve. So this is the area of attachment of the trigeminal nerve to the brainstem. So now these two roots, they slightly run upwards and forwards, and these roots, they end in a ganglia. So that ganglia, we say it as the trigeminal ganglia, or also called as semilunar ganglion, or also called as the Gesserian ganglion. So any name you can say. So it is commonly known as the trigeminal ganglia. It is called as semilunar ganglia because of its shape. So where exactly this trigeminal ganglia is located? So it is located at the anterior part of, or the apex of your, this is what is the petrous part of the temporal bone, which makes the boundary between, what do you say, the posterior cranial fossa and then the middle cranial fossa. So actually this ganglia is there in the middle cranial fossa. Where exactly this ganglia is situated? At the apex of the petrous part of the temporal bone, slightly extending on to the greater wing of the sphenoid bone. Okay, so that is the location of the, what is that, trigeminal ganglia. And it is, as you have the meninges within the cranial cavity, so this ganglia is located between the two layers of the dura, that is the meningeal layer and then the endosteal layer of the dura mater. Okay, so you see these are the two rootlets of this trigeminal ganglia. So very small motor root and a very big the sensory root of the trigeminal ganglia. So these two routes are again sleeved by or ensheathed by this meninges, sheet of your the pia, the arachnoid, as well as the dura will be covering these two sensory routes. You can say some few textbooks even explain, they say that these ganglia with this roots, that is sensory and motor root, they will be floating within the CSF in the subarachnoid space. Okay. So now that is the location of this trigeminal ganglia within the middle cranial fossa at the apex of your petrous temporal bone, extending onto the greater wing of the sphenoid bone. So this ganglia is associated only with the sensory root. So these sensory root fibers only rely in the this ganglia. Whereas the motor root is not concerned with your trigeminal ganglia. These fibers of the motor root, they don't end in the, what is that, trigeminal ganglia. It just passes below the ganglia, okay, and then mixes with the mandibular nerve. Okay, so now this ganglia on the anterior side divides into three branches. What are those three branches or three divisions? So they are your the maxillary, ophthalmic and the mandibular. So to be specific, from above down, you say first is the ophthalmic branch. So this is the ophthalmic branch. Okay, then second is the, or also called as V1. So V means the fifth. Okay, the Roman letter V. So that is the fifth nerve. So V1, we give ophthalmic the first number 1. So V1 is the ophthalmic. V2 is your the maxillary nerve, and then V3 is the mandibular nerve. So these are the three. Here in this picture the ganglion is taken out to show the structures which are related to it on the medial side of the ganglia. So this ganglia, you can say it is there in the lateral wall of the cavernous sinus. You know, you already studied this cavernous sinus. Okay, so having the roof, floor, medial wall and then the lateral wall. So this ganglia is there on the lateral wall of the cavernous sinus with its three divisions you can see in the lateral wall. So that is your ophthalmic. So slightly inferior to the cavernous sinus is the, what is that, maxillary, and even slight posterior to that will be your the mandibular nerve. Okay, so that is the association or the relation of the trigeminal ganglia with its divisions to the cavernous sinus. Okay, this is an important picture to show the relation of the ganglia with its branches to the cavernous sinus. So the three divisions are V1 ophthalmic, V2 maxillary, and V3 the mandibular nerve. So the roots of this ganglia are sensory root, which is bigger, and then the motor root, which is smaller. So only the sensory fibers they end here in, or actually speaking, they are the central branches of, or the central process of the pseudo-unipolar neurons which are situated within this trigeminal ganglia. I will explain that in the coming slides. Okay, so that is about the location of the ganglia, its sensory and motor root, and its three divisions. So now how exactly these three divisions they exit from the cranial cavity? See, ophthalmic nerve, the name only indicates related to the orbit. So this ophthalmic division of the trigeminal nerve enters the orbit through the superior orbital fissure. So you can see in this picture. Okay, so these three. So ophthalmic nerve enters the orbit by passing through the superior orbital fissure. And now maxillary nerve enters the pterygopalatine fossa, or you say it as even a spinopalatine fossa, by passing through the foramen rotundum. And then the mandibular nerve enters the infratemporal fossa by passing through the foramen ovale. So how exactly these three divisions of the trigeminal nerve exit the cranial cavity? Ophthalmic through the superior orbital fissure, maxillary through the foramen rotundum, and mandibular through the foramen ovale. So ophthalmic is the nerve of the orbit. The maxillary is enters the pterygopalatine fossa through your foramen rotundum, and the mandibular nerve enters your infratemporal fossa through the foramen ovale. Okay, so we will discuss these three divisions one by one. So first the ophthalmic nerve. I will not go into the details of all this area of distribution and all. So I will just explain the its branches. So this ophthalmic nerve, before entering into the what is that superior orbital fissure, divides into three branches. What are those three branches? The frontal, the lacrimal, and then the nasociliary nerve. So here is one more picture showing you the same three branches of the ophthalmic. So that is your nasociliary, lacrimal, and what is that? The frontal nerves. And even you know the what is that? You already studied the different branches of this nasociliary, the lacrimal, and even the frontal nerve and their area of distribution. So I will not go into the details of those three branches and in turn their branches and their area of distribution. So in broad I can say they carry all these what is that sensory what is that impulses from what is your pain, touch, temperature, pressure from this, and including your proprioceptive what is sensory input from the all the extraocular muscles. Okay, so which are again carried from the different other cranial nerves that are like third and the sixth cranial nerve. So this ophthalmic division is having communication with the third and sixth nerve. So this communication explains that this ophthalmic nerve receives the proprioceptive inputs from these two cranial nerves, that is third and sixth, from the extraocular muscles. So it carries all the sensory inputs from all the structures in the orbit except the retina. It even supplies secretomotor fibers to the lacrimal gland. And even it supplies the branches from your nasociliary nerve. So they will be associated with your the ciliary ganglia and the postganglionic fibers of which will supply your the sphincter pupillae and then ciliaris muscles. Okay. So those details you already learned. So my point here is to just to say you the three divisions of the ophthalmic nerve. Okay, that is your nasociliary, frontal, and lacrimal. So next division is your So this is again one more picture. You can go through it. So the three branches, inter and their branches like anterior model, posterior model, and continuation of the nasociliary as the infratrochlear nerve. So what are the branches from nasociliary is your anterior model, posterior model, and continuation of it as the infratrochlear nerve. The frontal nerve and its two divisions on the anterior side is your supratrochlear and supraorbital nerves. Okay, and the lacrimal nerve branches to the lacrimal gland and even the upper eyelid. Okay, and its communication with the zygomatic branch from your the maxillary nerve, through which you have the what is that the preganglionic fibers for your the ciliary ganglion are relayed, and then from there you know the what is the sorry the postganglionic fibers from the pterygopalatine ganglion are carried to the lacrimal gland through these fibers, which joins with the lacrimal nerve, so which goes and supplies your the lacrimal gland. So this lacrimal gland receives the secretomotor fibers from this zygomatic branch of the maxillary, but actually the preganglionic fibers the for that pre what is that pterygopalatine ganglia is through your the ninth nerve, the glossopharyngeal nerves. Okay, that I will come at the end of the class. That is the coming slides. The only thing is the lacrimal nerve will be carrying the postganglionic secretomotor fibers to the lacrimal gland. How do these fibers reach the lacrimal nerve? Through this zygomatic nerve connection. Okay, yeah. So this is again one more picture. I can say the chart explaining you the different branches and their area of distribution. So next is the maxillary nerve. So maxillary nerve is V2 we say. So it enters the pterygopalatine fossa. This is what is the pterygopalatine fossa. You can say between the pterygoid plate and then the posterior part of your what is that maxilla. Okay. So here this is what is the pterygopalatine fossa. So this nerve enters the pterygopalatine fossa from the middle cranial fossa by passing through foramen rotundum. So after its what is that exit through the foramen rotundum, roughly you can say it divides into three branches. What are those? So one is the zygomatic branch. This is what is the zygomatic branch, and the other is the infraorbital branch, and one more is the posterior superior alveolar nerve. What is that? Posterior superior alveolar nerve. So these are three divisions of your maxillary nerve. So and few more branches which are associated with your pterygopalatine ganglia, which is an parasympathetic ganglia. So I will talk about these autonomic fibers which are physically associated with the trigeminal nerve in one slide altogether. So all the four ganglions I will explain in one slide in the later part of this lecture. Okay. So timing you just remember the pterygopalatine ganglion related to your maxillary nerve. So what is the ganglia associated with your the ophthalmic nerve? It is the ciliary ganglion. Okay. So the pterygopalatine or the sphenopalatine ganglia with the maxillary nerve. So what are the three divisions of the maxillary? The zygomatic, the infraorbital, and the posterior superior alveolar nerve. So as they run further their further course, they divide into multiple branches supplying different areas like the nose, nasal cavity, even the upper jaw, the teeth in the upper jaw with their gums and all. Okay, so that is the area of distribution of your the maxillary nerve, that is V2. So this is again one more, you can say the line diagram to explain the branches of the trigeminal, that is maxillary division of the trigeminal nerve. So that is I said the zygomatic, the infraorbital, and then your the posterior superior alveolar nerve and branches associated with your pterygopalatine ganglia. So this is the area of distribution of your the maxillary nerve. So that is middle face, palate, sinuses, nasopharynx, nose. So this is the area of distribution of the maxillary nerve through its different branches. So now the next branch is the mandibular nerve. So it exits the cranial cavity through by passing through foramen oval. Okay, so it exits the cranial cavity through the foramen oval. So immediately after it exits through the foramen oval, So this mandibular nerve in the infratemporal fossa divides into two major divisions. One is the anterior division, the other is the posterior division. This is the anterior and this is the posterior division. So before dividing into two branches, two divisions, so few branches arise from the trunk of the mandibular nerve. So what are they? So this one is the meningeal branch. Okay. So all these three branches, the maxillary, ophthalmic and mandibular. So all these three nerves, they give meningeal branches which will be supplying your the dura, the meninges in the especially in the middle cranial fossa. Okay, remember that one more point. So meningeal branch and even one branch to the medial pterygoid. So only those are the two branches from the trunk of the mandibular nerve. So there is the meningeal branch, or also called as the nervus spinosus, and the other is the nerve to medial pterygoid. Those are the only two branches from the trunk of the mandibular nerve. So from the anterior branch you have many branches. So the important one is your the lingual nerve and even the motor branches like nerve to lateral pterygoid and even the deep temporal nerve supplying the temporalis muscle. Other than that you have what is that, the buccal nerve, okay, and one more motor branch is the mesenteric branch supplying your masseter nerve. So mesenteric branch, deep temporal branch, nerve to lateral pterygoid, and then your the lingual nerve. So one more important point I want to stress here is the joining of the chorda tympani nerve with the lingual nerve. So in this infratemporal fossa, I think just to recollect your memory from the class on infratemporal fossa where you studied, the chorda tympani branch of facial nerve joins the lingual nerve. So the chorda tympani nerve hitchhikes with the lingual nerve to reach its target organ like the different salivary glands, because this is the chorda tympani nerve which carries preganglionic parasympathetic fibers for your submandibular ganglion. The postganglionic fibers of which are the secretomotor fibers for your submandibular as well as sublingual salivary glands. And even this chorda tympani nerve carries the taste sense from the anterior two-thirds of the tongue. So all those fibers of the chorda tympani up to this point from their target organ, that is up to the in the region of the infratemporal fossa, they are mixed with the lingual nerve. So that's why, so if there is any damage to the lingual nerve below this point of junction, you will have loss of what is that, taste sensation from the anterior two-thirds of the tongue. So because along with the sensory fibers or the somatic sensory fibers, even this the special sensory fibers are also damaged along with the those fibers because they run along with the lingual nerve. And even you have dryness of the mouth because the secretomotor fibers to these ganglions are also damaged along with the general sensory and even special sensory fibers. So that is the one important point you should keep in mind, that is joining of the chorda tympani nerve along with the lingual nerve. Okay. So now the posterior division, it runs through your the mandibular foramen as your inferior alveolar nerve supplying all the teeth and gums of the lower jaw. Okay. And even it exits through the mental foramen supplying the skin at the chin of the what is that face. And one more important motor branch from this posterior division is nerve to mylohyoid, so which even supplies your anterior belly of the digastric. So all these 8 muscles what I said, the special visceral efferent component or with the mandibular nerve. So which is the only nerve of the trigeminal or only branch of the trigeminal which is having the motor fibers or the efferent fibers. The other two like maxillary and ophthalmic only sensory fibers. Okay. So you have submandibular salivary ganglia associated with the mandibular nerve. Even you will have the otic ganglion which is physically associated with your the mandibular nerve. So that's all about the rootlets of the trigeminal ganglia. the position of the or the location of the trigeminal ganglia, the area of attachment of the roots of the trigeminal ganglia to the brainstem, the branches of the trigeminal ganglia, that is ophthalmic, maxillary and mandibular, and their way of exit from the cranial cavity, and their further course and branches. So that's all we discussed till now. Okay. So now let's move to the nuclei of the trigeminal nerve. So we already completed the brainstem. You know there are four major nuclei associated with the trigeminal nerve, and even you know the point that the trigeminal nucleus extends throughout the brainstem. So that is, it even is there in the midbrain, it is there in the pons, and even it is there in the medulla also, and even extending into your spinal cord. So what are those nuclei? So you have four main nuclei associated with the trigeminal nerve. So the one which is present in the midbrain is the mesencephalic nucleus. So this is what is the mesencephalic trigeminal nucleus. The one in the pons is the one motor nucleus, and the one principal sensory nucleus. So this sensory nucleus is continuous. So which is present in the midbrain is the mesencephalic nucleus, which is present in the pons is the principal sensory nucleus, and the same which extends, what is that, caudally, is your the spinal nucleus of the trigeminal nerve, which extends through the medulla and even into the spinal cord, small part of the spinal cord. So three sensory, what are they? Mesencephalic in the midbrain, principal sensory in the pons, and spinal nucleus of the trigeminal nerve in the medulla. And one more is the motor nucleus, that is also present in the pons. Okay, so these are the nucleus with the trigeminal nerve. So now this is the trigeminal ganglia, which is there in the middle cranial fossa. So any ganglia, it will have neurons. So what kind of neurons you find in this trigeminal ganglia? So you all know that any sensory ganglia will have pseudo unipolar neurons. Pseudo unipolar neurons. They are located here in the trigeminal ganglia. So the peripheral process of these neurons, the trigeminal ganglia, they run through the three divisions like the maxillary, ophthalmic, and then the mandibular. So that is the peripheral branches or processes of these pseudo-unipolar neurons in the trigeminal ganglia. They run through the three different branches of the mandibular, that is ophthalmic, maxillary, and mandibular. Their central process, that is the point here, their central process run through the sensory root, of the trigeminal nerve, and they end in the principal sensory nucleus and then the spinal nucleus of the trigeminal nerve, but not the mesencephalic nucleus. Very important. So I repeat, the pseudo-unipolar neurons which are there in the trigeminal ganglia, their peripheral process run along the three divisions of the trigeminal nerve, that is maxillary, mandibular, and ophthalmic, whereas the central process ends in the principal sensory nucleus and the spinal nucleus of the trigeminal nerve. And what sensory or what sensations they carry? What sensory impulses they carry? The pain and temperature from all the areas of the face and head, including your everything, that is tongue, the oral cavity, the teeth, gums, nose, nasal cavity, the paranasal air sinuses, all these pain and temperature senses, sensations are carried through these peripheral process, and they are relayed in the spinal nucleus of the trigeminal nerve. Very important. Okay. Whereas the touch impulses are relayed into the principal nucleus of the trigeminal nerve. Principal sensory nucleus of the trigeminal nerve. So now how about the proprioceptive impulses? So proprioceptive impulses, the neurons which carry these proprioception, impulses are located in the mesencephalic nuclei of the trigeminal nerve itself, not in the trigeminal ganglia. So it's the only instance where you find this what is that primary sensory or first what is that step of sensory neurons located within the central nervous system. So all the primary neurons associated with the sensory impulses are located outside the central nervous system, either in the dorsal, what is the nucleus associated with your the spinal cord, or with this your like your trigeminal ganglia. So they are outside the central nervous system. It is the only instance where the primary neurons which carry these proprioceptive impulses from the head face region, including your the extraocular muscles and all, the muscles associated with your the tongue, even the pharynx, larynx, they all pharynx and like your what is that tensor tympani, velum palatini, all those muscles. Okay, so those are relayed in the mesencephalic nucleus of the trigeminal nerve. Okay, so not in the trigeminal ganglia. So please keep this point in mind. So the primary neurons are located in the mesencephalic nucleus, not in the trigeminal ganglia. So what sensory impulses they carry? Only the proprioception. Okay, proprioceptive impulses are relayed directly in the mesencephalic nucleus, not in the trigeminal ganglia. Okay, the first order neuron is for touch and pain, temperature, other sensory impulses, they are in the trigeminal ganglia, but not for the proprioceptive impulses. So the first order neuron for this proprioceptive impulses, they are in the mesencephalic trigeminal nucleus directly. Okay, so this is about the sensory, that is component, that is your general somatic afferent component. How about the special visceral efferent? That is the motor nucleus of the trigeminal nerve. So the same, the nerve fibers, they extend through the motor root and they do not rely in the trigeminal ganglia. So the motor root doesn't end in the trigeminal ganglia. It passes below the trigeminal ganglia, and these fibers they mix with the fibers of the mandibular nerve. Okay, so through which they enter through your foramen ovale and exit the cranial cavity. Okay, so this is about the sensory root and then the motor root of the trigeminal nerves and their what is that connections with the nuclei. So you have three nucleus: sensory nucleus, mesencephalic in the midbrain, principal sensory nucleus in the pons, and then spinal nucleus in the medulla. The spinal nucleus receives sensory inputs from the primary neurons located in the trigeminal ganglia carrying pain and temperature impulses, whereas principal sensory nucleus receives the primary what is that first order neurons which are located in the trigeminal ganglia carrying the touch, whereas mesencephalic nucleus has the primary motor neurons, the peripheral process of which will carry the proprioceptive impulses from the head and face region. Okay, the primary neuron itself is located in the mesencephalic nucleus, whereas the primary or first order neurons carrying the touch, pain, temperature, other impulses like pressure and on vibration, they are all located in the trigeminal ganglia. So this one point of difference you should keep in mind. So this is the only area or only instance where the primary or the first order neurons sensory in the sensory pathways are located within the central nervous system. So nowhere you find the primary or this first order neurons in the sensory pathway are located in the central nervous system. So they are all outside the central nervous system. Okay, so only the second order neurons they begin in the central nervous system, not the first order neurons. Always first order neurons are outside the central nervous system. It's the only instance where the first order neuron is located within the central nervous system, that is mesencephalic nucleus carrying proprioceptive impulses from head and face area, including your the extraocular muscles and all those muscles which are supplied by your mandibular nerve. So that's it. So that is about the nucleus associated with the trigeminal nerve. This is again one more diagram to show you the same what I explained till now. So this is the trigeminal ganglia. These are three divisions. So green all is the sensory root and this orange is the motor root. Okay. So these three divisions and different sensations which are carried by these three divisions and what exactly what area like what sensory inputs they are carrying and how they are relayed. So that is the same point what I explained till now. So again one more picture explaining you the same. So this is the trigeminal ganglia where you have the location of all these. What is that? Primary motor neurons, the pseudo unipolar neurons, the peripheral process going through these three divisions of the trigeminal nerve or the ganglia, and the central process going to the principal and spinal nucleus of the trigeminal nerve. Yeah, so this is the slide I was what is that stressing on in the what is the previous slide. So that is the autonomic ganglia or the fibers associated with the trigeminal nerve, the physical association, just the physical association, but functionally they are with the other cranial nerves. Which cranial nerves? I said it is the 7th and the 9th. So you know the 4 ganglions are there. So you can see it here. This is the pterygopalatine ganglia. So this is what is the otic ganglia and this is what is the submandibular what is that salivary ganglia. Okay, and the actually the other ganglia is not shown in this picture, that is ciliary ganglia. So that is with the nasociliary nerve. Okay, yeah. So this pterygopalatine ganglia, you know, it receives its preganglionic fibers through the petrosal nerve or even through that is your pterygoid canal. We say it as nerve of the pterygoid canal or you say it as the greater petrosal nerve, which is a branch from facial nerve. It's a branch from facial nerve. So it is associated actually with the pterygopalatine ganglia. So those fibers they reach the pterygopalatine ganglia. So now the postganglionic fibers from this pterygopalatine ganglia, so they run along with this. What is that? The branch of the maxillary nerve. This is the maxillary nerve. So what is this branch? The zygomatic. So which in turn divides into zygomatico-temporal and zygomatico-facial. So it runs through the zygomatico-temporal and mix with the lacrimal nerve. So it is very important. So this connection of the zygomatico-temporal nerve with the lacrimal nerve. So now through the lacrimal nerve they reach the lacrimal gland. So these are the secretomotor fibers to the lacrimal gland. So actually as I said, so they are not related functionally with the trigeminal nerve but functionally with the facial nerve. Yeah. So that is about pterygopalatine ganglia. And even you have few direct branches from the pterygopalatine ganglia which will be supplying your all the nasal glands which are associated with your what is that nasal cavity and even your paranasal air sinuses. So now this is the otic ganglia. Even the otic ganglia receives its preganglionic fibers through the lesser petrosal nerve. Okay, so lesser petrosal nerve, which is again a branch from your what is that? Lesser petrosal nerve is a branch from your is a from your what is that? The glossopharyngeal nerve. So which comes and relays here, and from there the postganglionic fibers they run through the auriculotemporal nerve, which is a branch from the mandibular. Okay. So then the postganglionic fibers they reach the parotid gland. So that's how the parotid gland receives its secretomotor fibers. Okay. So functionally these fibers are not associated with trigeminal but associated with the glossopharyngeal. Okay. So now you have this, what is this? The submandibular ganglia. The preganglionic fibers for this submandibular ganglia, they come through your the chorda tympani nerve, so which runs along with the lingual nerve. So now the same postganglionic fibers they mix with the fibers, they mix with the lingual nerve and then reach the target organ, that is your submandibular salivary gland as well as the sublingual salivary gland. So that is the physical association of these branches of the trigeminal nerve with these 4 autonomic ganglia or the parasympathetic ganglia, that is pterygopalatine, the otic, the submandibular as well as the ciliary ganglion in the orbit. It's only the physical association. So I can say like the fibers of the glossopharyngeal and the facial, they hitchhike with the branches of the trigeminal nerve to reach their target organ. So that's all about the anatomy of the trigeminal nerve. So now few of the clinical aspects. So you might have heard the term like trigeminal neuralgia. So what is the trigeminal neuralgia? The patient will feel the pain, extreme pain, which comes in episodes, 10 to 15 minutes it stays and then comes back again. The pain along the area of distribution of these three branches of the trigeminal nerve. So whenever there is irritation of the trigeminal nerve, the cause of this trigeminal nerve is not known, but few they explain it like the condition, the most condition like multiple sclerosis, where there will be inflammation of this your trigeminal ganglia or any tumors associated with the vessels and all. If they press upon this trigeminal nerve, it will irritate the nerve and cause inflammation, and then you will have pain along its area of distribution. So that is the what we call it as trigeminal neuralgia. In this picture you can see, so these are all the three divisions of the trigeminal nerve. So the redness shows you the pain and the patient experiencing in this areas, okay, their area of distribution. Okay, so what exactly the treatment aspect? Treatment is you have to what is that, block these nerves. So they will go for mandibular nerve block or the maxillary nerve block or the whole trigeminal nerve block itself to prevent the what is that extreme pains which are experienced by the patient. So that we call it as trigeminal nerve block or mandibular nerve block or maxillary nerve block, like that. Okay, so this is the where they are inserting a needle to the what is that individual nerves. For example, here in this they are trying to block the mandibular nerve, so by injecting an anesthetic agent so that they will relieve the pain for the patient. So that is the treatment aspect about trigeminal neuralgia. So this is the one condition associated with the trigeminal nerve. And as I said in the beginning, it's because of its wide area of distribution. So any what is that infection or inflammation in any of their area of distribution. For example, if there is any what is that caries of the tooth, the patient may have the headaches along with the toothache. So why that headache along with the toothache? It explains because the referred pain, because the trigeminal nerve, it even supplies the dura mater. In even sometimes the patient may feel pain in the ears also, because the branch, that is the auriculotemporal nerve branch, it also supplies the external acoustic meatus. So there may be referred pain from the tooth into the ear or to the head, causing your headaches and earaches in case of the patient suffering from the caries tooth. Okay, so that explains the referred pain, because the area of distribution of the trigeminal nerve is wide. So that's why any conditions associated with what is that inflammation or of the in the orbit or any ulcer in the cornea and all, so the patient even may complain of headache. So that explains the area of nerve supply of the trigeminal nerve, because it even supplies the dura, which is sensitive to pain. This is one slide, so explaining all the branches of the trigeminal nerve and their functional components, where exactly their area of distribution. And this is the branches. This column explains the branches, this column explains your what is that the sub branches of these individual branches of, for example, this ophthalmic division, which main branches are frontal, lacrimal and nasociliary. So in turn their branches, frontal nerve giving rise to superior orbital, supratrochlear, and their area of supply. Okay, so these are the branches and this is the area of distribution. Very good. We can weigh all the what are the functional components, the branches and all compiled in one table. So this whole this table summarizes the whole trigeminal nerve. So this is again one more last slide. So one important silent features what I explained which are associated with the trigeminal nerve. So like one, what is it with this? All cell bodies are in trigeminal ganglia except for proprioception, and these are in the mesencephalic nucleus in the brainstem. That is which neurons? The primary sensory neurons, or what we say the first order sensory neurons. So for pain, touch, what is that, pressure, temperature, they're all located in the trigeminal ganglia. But for proprioception, they are located in the mesencephalic nucleus. Very important. That is one important point you should keep in mind. So one more point I said is special visceral motor or special visceral efferent component. Why it is called as special? Because the motor fibers, they supply the structures which develop from your the first branchial arch or the first pharyngeal arch, that is the mandibular nerve. Okay, yeah. So mostly sensory, but small motor branch in mandibular nerve. So as I said, the ophthalmic, the maxillary, they are purely sensory, whereas mandibular is mixed with small part having the motor component. Mandibular also contains majority of the fibers are sensory, but small part it is again the motor. So mandibular is the mixed nerve, whereas ophthalmic and maxillary are purely sensory. And this is one more point I was explaining about the location of the trigeminal ganglia. So that cave, what we call it as trigeminal cave, are also named as Meckel's cave. So that sleeve of the dura in which this trigeminal ganglia is located is called as Meckel's cave. Okay, yeah. So these are few of the important points you should keep in mind about the trigeminal nerve, so which is mentioned as extra nodes. So even you have the nuclei, very important. So nuclei of the trigeminal nerve extends throughout the brainstem. Mesencephalic nucleus in the midbrain, principal sensory nucleus along with its motor nuclei in the pons, and the spinal nucleus in the medulla. Okay. So that's all about the trigeminal nerve. Thank you.